Multiple evidence suggests that TGF-beta signaling pathway is frequently dysregulated in squamous cell carcinoma of head and neck, specifically HPV-positive SCCHN. So M7824 is a bifunctional fusion protein targeting both TGF-beta and PD-L1. So we think that M7824 had anti-TGF-beta activity. This drug may be suited for the treatment of SCCHN, specifically HPV-positive squamous cell carcinoma of head and neck. So the study is basically phase 1 study. It is composed of dose escalation and dose expansion cohort. So in the dose escalation phase, the safety and tolerability of M7824 was evaluated from 0.3 to 30 milligram per kg every 2 weeks in a dose escalation phase. And in dose expansion cohort, best overall response rate to M7824 was evaluated in 32 squamous cell carcinoma of a head and neck patient. So the key finding of our study is that M7824 targeting both PD-L1 and TGF-beta is very active in HPV-positive squamous cell carcinoma of head and neck. So objective response rate to this drug in HPV-positive patient was up to 50%. So if you look at the previous data with nivolumab or pembrolizumab, in this population, the objective response rate is around 10 to 50%. So although this data came from phase 1 in a relatively small sample size, the objective response rate up to 50% is really increasing, and we need further study of this drug in this indication. So we demonstrated very increasing clinical activity of M7824 in HPV positive cancer, especially in our study, squamous cell carcinoma of head and neck. We do know there are several cancer types which are associated with HPV infection, such as cervical cancer and anal cancer. So we need to evaluate safety and anti-tumor activity of M7824 in these indications too. M7824 is a bifunctional fusion protein, so it has a dual effect targeting PD-L1 and TGF-beta. So current data suggests that a combination of IO may have better clinical activity than single agent PD-1 or PD-L1 immune checkpoint inhibitor. So I expect more and more clinical study will be done to combine immunotherapy, current immunotherapeutics such as nivolumab, pembrolizumab, avelumab, and atezolizumab with other novel immunotherapeutics such as vaccine and STING agonist, toll-like receptor agonist, etc.